Welcome to Voices from the Field, a podcast produced by the National Collaborating Center for Indigenous Health. NCCIH focuses on innovative research and community-based initiatives promoting the health and well-being of First Nation, Inuit, and Métis peoples in Canada. On this episode, advocacy for elders. Elders like Doris Young, a resident of the Opaskwayak Cree Nation in northern Manitoba. She recently wrote about the treatment of seniors in Canadian long-term care homes. According to Young, in this troubled time, the elderly are suffering far too much. They have paid far too high a price for getting old. Too many of the nursing homes they have been placed in have not been caring responsibly for these precious community members. Here, Young shares Cree concepts about elders and their significant role for cultural continuity and community well-being, a call to remember our responsibilities to them in a pandemic like COVID-19.
Our elders are not forgotten. People look out for them to see that they're okay and that they're not being harmed. I want to talk about the philosophy by which we live under. The Cree word for elders really is kiteyak, and that means that they're the people of the heart. That's what kiteyak means. And so our language contains the way in which we are to address and look at our elders. If they are people of the heart, we have a responsibility to them. They had a responsibility to us when they were at our age and looking after us. They carried with them the values of caring and sharing, being kind, and their usefulness was not forgotten. Their productivity is still valued in our communities. We are respectful to them. We value their knowledge. We look up to them to give us guidance, and they still lead our community in many ways. That's how I would look at this whole issue of elders. And I'm speaking, when I say kiteyak, I'm speaking about the Cree language and the Cree culture. That's how I would look at how we would treat our elders.
In her piece, Young had this to say: "Elders have given us so much, and most don't ask for anything in return. They need attention and love, as well as proper medical care. Love is not a financial cost, it is a human responsibility." To hear more podcasts in this series, head to the Voices from the Field homepage, located on the website of the National Collaborating Center for Indigenous Health, NCCIH.ca. Music on this podcast is by Blue Dot Sessions. It appears under a Creative Commons license. Learn more at www.sessions.blue.